And I want to ask specifically about hospitalization. One of the recent concerns, I'm sure you're getting asked a lot about this. How do you explain the sudden increase in hospitalizations among children? I mean, if Omicron is less severe and 15 to 20% less likely to send someone to the hospital, why are we seeing this sudden increase in children at hospital with COVID?
Well, that's a good question, and there are two things that contribute to that. First of all, quantitatively, you're having so many more people, including children, who are getting infected. And even though hospitalization among children is much, much lower on a percentage basis than hospitalizations for adults, particularly elderly individuals. However, when you have such a large volume of infections among children, even with a low level of rate of infection, you're going to still see a lot more children who get hospitalized. But the other important thing is that if you look at the children who are hospitalized, many of them are hospitalized with COVID as opposed to because of COVID. And what we mean by that, if a child goes in the hospital, they automatically get tested for COVID, and they get counted as a COVID hospitalized individual, when in fact they may go in for a broken leg or appendicitis or something like that. So it's overcounting the number of children who are, quote, hospitalized with COVID as opposed to because of COVID.
You should be wearing masks even when you are vaccinated if you are indoors.